The human rights and social justice activist, he's editor at Citizen Maverick, Mark Heywood, joins me now. Mark, good evening to you. Well, the hospital described today as filthy and neglected. I imagine this doesn't come as a surprise to you.
Good evening, Stephen. No, it doesn't come as a surprise. Doctors and patients have been saying for years that the hospital is filthy, neglected, unsafe, that healthcare workers are working in stressful, dangerous conditions, and that lives are being lost as a result of all of these conditions. So, you know, the healthcare workers, Dr. Tim de Maayer, but not him alone, there's many dedicated healthcare workers at that hospital, feel vindicated, but they feel no great sense of relief or victory in this, because as we sit here today, those are the conditions that pertain at this hospital, and the big question is whether this report will lead to action and the recommendations being carried out and being carried out swiftly.
The thing is that this has taken a very long time to get here. I mean, as you say, Dr. de Maayer's open letter perhaps started this, maybe didn't, in fact. But it's taken a whole investigation by the health ombudsman to get to this point. Surely it shouldn't have taken all of this action to find out what any patient there would have already known.
No, I mean, the health ombudsperson's report is important, and he has an important statutory obligation to investigate and to ensure that standards are maintained in our public hospitals. But that responsibility doesn't lie with the health ombud alone. The responsibility lies primarily with the Gauteng Health Department, with the MECs for Health, and with the Premier. And healthcare workers, not just at this hospital, but hospitals across the province, have been complaining about the conditions in these hospitals for many years and seeing little progress. You know, in fact, Stephen, this is the third adverse finding by the health ombud against Gauteng province, starting with Life Esidimeni, and we know what's happened there. More recently, the Tembisa Hospital, and now Rahima Moosa Hospital. 3 strikes, you should be out. 3 strikes, they should get rid of the MEC, the head of health, the CEO of this hospital, and the Premier should bring about an emergency plan to fix Gauteng Health, because the ramifications for mothers and children in this hospital are horrendous. And a lot of what Professor Makgoba talks about is the violation of a very fundamental right of all people in South Africa, and that's the right to human dignity.
I mean, Gauteng Health has issued a 3-paragraph statement on this today. They say that they're not doing interviews. I know that people here at Newzroom Afrika Channel 405 have been asking them for interviews. What does that say, that they won't even come to account?
Well, you can only draw one conclusion from that, which is they feel unaccountable, and I guess they don't have any justification for the findings of this report. There needs to be a radical overhaul of that department. Stephen, I was talking to a senior doctor at Chris Hani Baragwanath Hospital just 2 days ago, and he was lamenting that in his 35 years as a surgeon at that hospital, things have never been as bad as they are now. And you hear that from a range of people. There needs to be an emergency rescue plan for Rahima Moosa, but also for the whole of the Gauteng healthcare system.
At Rahima Moosa, it turns out that Gauteng Health changed the criteria to appoint the CEO. They made it easier to appoint this particular CEO. And then we hear in the Ombud report that basically, to oversimplify, she didn't come to work half the time. She claimed all sorts of reasons for that. She was doing all sorts of things. I mean, how can this happen? Does this point to some sort of politicking? Does this point to some kind of, I mean, almost deliberate weakening of a hospital if you do that? It's obvious what the consequence will be.
It points to cadre deployments. It points to people in higher places than the position of the CEO, putting people into positions where they can get access to resources, access to tenders. It points to the fact that quite often competency and the right of access to healthcare services is not the first concern of the people making these appointments. And I should say here, Stephen, that, you know, Rahima Moosa is one of the hospitals that forms the platform of Wits University's Faculty of Healthcare Science Sciences. It's a teaching hospital. 1 year ago, almost, Wits University and the Gauteng Department of Health signed a memorandum of agreement, signed by then Premier Makura, that they would henceforth, amongst other things, be joint appointments, that the Gauteng department would consult the university on all appointments, including CEO appointments of hospitals. But that MOA was signed in June, I think, 2022. Nothing has been done to implement it since then. So it also seems as if people want to protect the current ways of doing things, again, at the expense of the patient.
Mark Heywood, thank you very much indeed.